One of the things that's really interesting and why I enjoy mentoring students and junior faculty, I love to be able to explain to them that my path was really not a straight path. And that's probably much more common than they think.
I think we both at some point in our lives were told, you can't do this, you can't become a doctor. She told me one story where one of her teachers in college told her, don't even try because you won't make it. And I think that's not an uncommon story, unfortunately, even now for many people. But I think, like many, Dr. Maldonado said, well, I'll just show you.
Dr. Maldonado is entirely responsible for my entire professional career. She might not admit that, but it's totally true. She was the very first grown-up faculty member that came to give a dorm talk. You have this woman walk in who is this bright, young, pediatric infectious disease attending who just finished her 2 years as a virus hunter with the CDC and was now doing research on viral diarrhea in daycare centers in Palo Alto and Mexico City. I was like, if that's what a doctor does, I can do that. Sign me up.
I was always torn early on about what kind of career did I want. I loved science, I loved medicine, but I also loved the concept of public health and prevention. I thought about what you could do with a young life before the infant was even born, and beyond that, in the first formative years, to prevent diseases.
Bonnie combined her infectious disease specialty research with very active involvement in public health and understanding how to deliver vaccines most effectively and how to make sure that children in various communities get the benefits of vaccine.
More and more, we're seeing that vaccines can prevent up to 3 million deaths a year. These are the things that we should be doing all around the world to make sure that children at least can survive, and then we can get them to thrive. I grew up in Southern California. I'm from the greater Los Angeles area. My parents came from Mexico and they immigrated to the US shortly after they got married. They were very involved with the community. They were always the first ones to volunteer to help. For example, my mom used to work 35 miles away, so she'd have a long drive back and forth in Los Angeles traffic. But she would stop on her way home and go to the Braille Institute and read books in Spanish because she just thought this was her way of giving back for all the blessings that she felt she'd had experienced throughout her life.
I became a dean at Stanford Medical School in 1983. I remember first meeting Bonnie as a clinical student. She was very bright, very energetic, and very outgoing. She was, at that time, a very vocal leader of the Latino medical students. Early on, I think I saw her as a leader.
It was really exciting to be able to advocate for medical students around the country and look at the broader issues around medical care and what we were doing for patients and how to be the best doctor possible.
I met Bonnie the very first month that I was on our clinical infectious disease service in the Children's Hospital as an attending physician. I was so impressed by her abilities as a medical student. She was terrific at her clinical work.
It was probably the most exciting time of my life, even more than college, because I was doing what I really wanted to do. I was lucky and I was fortunate that there was a position available in the residency program at Johns Hopkins. We were the trauma center for 3 states. I learned a lot. That's where I really started to develop my research interest in infectious diseases. I was working on rotavirus, which is a virus that causes diarrheal disease, and at that time would kill more than 1 million children a year.
Her ability to go from bedside to big picture and to build from one person to 1 million kids and to sort of put the vision out there that we don't have to accept these big problems are somehow insurmountable. We can discover a way forward that will in fact transform our communities and transform the next generation.
That's what led me to go to CDC, because I realized that I needed to hone those skills. I needed to hone my epidemiologic skills, my public health skills, my skills in understanding how you take a disease, understand the disease, develop a scientific rationale for how that disease happens in a population, and then move to the next level of policy and public health.
Bonnie's work on polio vaccine showed that you could really prevent transmission of polio with intensive vaccination programs in underdeveloped areas, under-resourced areas.
I was doing my research in sub-Saharan Africa and also in Latin America and Mexico, trying to study the way the polio vaccine worked and how to improve that to eliminate polio. The challenge in global health, of course, is that simple measures in the United States are not so simple when you're working in resource-poor settings.
How do you get people to recognize that this is something that's helpful? When you have a different language, a different culture, it's not always easy to engage people to be participants in anything. The way that she has done it, from what I understand, is really reach out to the infrastructure that's there, respecting where they are and trying to bring them in and seeing what they need and what you can provide. The reason to do good science is not just for the United States, it's for the whole world.
As she was finishing her tour at the CDC, she got in touch with me, and I was even more certain than ever that I wanted her as a member of our Pediatric Infectious Disease Division as a faculty member.
What happened during my time at Johns Hopkins and then CDC, and more importantly when I came here, was the HIV epidemic. I started the HIV clinic here, and I built an epidemiologic study in collaboration with the State Health Department and CDC to understand the natural history of HIV in children so that we could develop treatments and potentially cures.
The ability to deliver antiviral drugs at the time babies are being born is critical for preventing the transmission of infection. She was on the front lines carrying antiviral therapies to mothers and babies in very challenging environments at the peak of the HIV epidemic. Bonnie's work has had very significant impact on the health of babies in Zimbabwe.
Currently, the status for mothers and children is that we've essentially almost eliminated HIV transmission from mother to baby in the US. And we are well on our way to doing that in the developing world.
She is really indomitable. She is not ever going to say, can't be done, let's try again in a year or two. She's persistent and dedicated.
Dr. Maldonado and I started to work more officially together when she became the Senior Associate Dean. And part of that process involved what we call the Diversity Cabinet. It's really an open door for anybody that wants to be part of the discussion of diversity at this medical school.
We want, as much as possible, for our physicians here at Stanford to look like the face of the United States and the face of our patients, and really trying to give opportunities to people who may face disparities in their ability to get the education that they need to be able to succeed.
That theme of let me show you what I can do is something that people like Dr. Maldonado, who have not only just succeeded, but succeeded to the highest extremes in the sense of being internationally known and being a leader in medicine, just reminds us how we can't make those judgments about who can be a physician or a leader in science.
Bonnie has done a wonderful job as chief of our Pediatric Infectious Disease Division. She's expanded our physician team. She's expanded our education program. She's supported many new faculty. She's been a tremendous mentor for every one of them.
When you are thinking about yourself and your career and your life and your family, that's a separate role that you have, but you should always think about yourself in your leadership role.
Particularly young women who are going into medicine and going into academia, they want to see successful women who have managed to balance and combine and, move forward in all their aspects of life at once.
Mentorship's always interesting because you never know what's going to happen when you even talk with somebody just for a day, let alone pick them up as a mentee for a long period of time.
So whenever I have major life and professional events, I call her up and I'm not asking permission, but I'm checking in. And even this latest adventure, and she's been nothing but completely supportive every single time. She is so warm and so open and so accessible that I think that's part of what makes her special as a doctor, as a teacher, as an educator, as a mentor, because she's just genuine. And she makes you feel like, there's no dumb idea and that you can ask for help. And if that's not a magical talent, I don't know what is.